Again, I moved to this community 12 years ago, about 12 years ago, and I was really pleased to find out the quality of the health care that we have in this community, both from a health system perspective and all the social agencies. Just really good support systems and really great people in this community doing great work. And so, again, leveraging those resources, and as Chad pointed out, several of the access points and information that we can get to continue momentum and push towards our objectives with improving the health of the community. Next on the agenda this morning is Charlie Geier.
Geier.
It's Geier. Charlie is the, I love this title, Vice President of Impact. I always,
it's cool, isn't it?
It is cool. Yeah, Vice President of Impact and Data Solutions for the Indiana Youth Institute, and he's going to talk to us about the state of the health of the child. So
all right,
welcome,
good
Charlie.
morning, South Bend. How are you? All right, so some energy going. Kids, it is absolutely vital that we think about kids and we think about the work that we're doing with the Healthier Alliance. They are the future. One of the themes that we have that you're going to hear over and over again from what I'm going to say, from what you've heard before in the panel, is this idea of working together. And I want us to think about how we work together for kids when we think about health. I think oftentimes when we think about working together, we use the word collaborate. I think it's a very useful word, it's a good word, but let's think about it for just a moment. It's sort of self-serving, isn't it? Because it's saying, what are you doing that I can maybe learn a little bit about, steal, and then apply it in my context? I want us to think about the word convergence. And the difference here is convergence means that we have a common goal that we're working together towards. So as you think about the sector that you represent, whether it be business, nonprofit, health, education, how can we all work together in convergence to impact Hoosier Health? And specifically, what I'm going to talk about for the next 15 minutes, the health of our children. So why does it matter? You see, we all benefit when the next generation is healthy, safe, well-educated, and economically secure. And health is foundational for child well-being. If the child is not healthy, education cannot happen. If the child is not healthy, then economic security cannot happen. Health is foundational to the whole well-being of children. And health challenges impact the whole family. You heard it in the testimonies of both Craig and Chad. They talked about personal stories that won, which is so powerful. It was a grandson and it was a son. And I wonder if as you thought about your one, was it a child? Was it a mother or a father? You see, the work that we're talking about, when we talk about health, it impacts the entire family. And lastly, what we're interested in is making sure that we spark discussions that lead to action. That today just isn't about sharing information, but I hope that you find something significant, that maybe it raises a question, and you say, I need to find more, I need to learn more, I need to work in convergence with somebody in this room. So let's talk about who are Hoosier kids. We have 1.5 million kids here in Indiana. Now, what's fascinating is about 34% of those children live in single-parent families, and we're becoming more diverse overall. You see about 26.6% are children who are race or ethnicity other than white, non-Hispanic. That is growing over time. We have a higher number of children who speak a language other than English at home, currently at 10.4%, and we have more immigrant children here in Indiana, around 12%. All of these are growing. They're changing. They're going up. We're becoming more diverse in who the children are and also in family structure. Around 18% of kids live in a family with an adult other than their mother or father. So it could be a grandparent, it could be a foster parent, around 18%. So let's think about how we stack up nationally. We know we rank 38th overall, kind of in general for everybody. But nationally, for kids, what I would sum it up in one statement is this. Nationally, you see, we excel in few areas, we lag in most, and we most importantly need to improve in all. So as we look at child well-being, overall we're 28th, and that includes these domains. Families and communities is 31st, economy is 19th, that's up slightly from 24th just 2 years ago. Education 14th, that is our highest ranking overall. In 2012, we were ranked 36th. There has been significant improvement in education, and we know there's been a lot of attention in education as well. from a policy level and from a legislative level. That's had an impact here in Indiana. We've moved from 36 to 14. But if you look at health, very much like the overall, at 38th, we are ranked 35th. This particular statistic includes these areas: low birth rate babies, children without health insurance, child and teen deaths, and teens who have used alcohol or drugs, just so you know where that statistic comes from. When we look at our other national rankings and different indicators, over here on my right are the highest 5. What do you see? What is common in these areas? You see that it is mostly education and economics. Our highest ranking is 8th grade math proficiency, most recently released by NAEP at 7th. High housing burdens is 9th. Indiana is a pretty affordable place to own a home in a lot of ways. 4th grade proficiency is 10th. Graduation rate is 12th. And what's interesting about graduation rate is that we saw a steady increase from 2007 and 2012, and it sort of plateaued. And recently, it dipped from about 90% to around 87%. Now, over here are our lowest 5. Child maltreatment. We are ranked 47. That is our lowest indicator. That includes physical abuse, sexual abuse, and neglect. And many of the issues that we're talking about today are aligned or feed into this particular issue. Infant mortality, 42nd. Child and teen deaths, 37th. Let's talk about child maltreatment for just a moment. You see, we have 52% increase over the past 5 years. And the hotline, the Child Abuse and Neglect Hotline, receives an average of 1 report every 2 minutes. Think about that. From the 2 hours that we're here today, it's going to be 60 to 75 new reports, just the time that we've sat here. You see the overall number of reports has grown pretty consistently and drastically from 2012 at 155,000 to 2016 at 225,000. When we dive into these numbers a little deeper, there's a theme that starts to arise, really across all of them, and really in every area of child domain. So that could be child well-being domain, so safety and economics, and health, families and communities, and that is this, that there are clear, disproportionate challenges and barriers that exist for children, not only by race, but also by place, income, and immigrant status. There's a clear theme. I'm going to demonstrate that in just a moment. And we also know there are critical issues that are impacting kids, and these are the 4 we're going to talk about today. Not the only 4, the 4 that we're called to action to today. And most importantly, I'm going to bring up this idea of convergence, because as I go through these, I'm going to show opportunities and ways individuals, communities, and policymakers can get engaged, to get practical. It's the how. How are we going to do it? So let's start with infant mortality. You see, Indiana infants are 24% more likely to die before their first birthday than infants nationally. Our governor, in his most recent State of the State address, called us to action, called the state to action. He said by 2024, he wants Indiana to be the best in the Midwest when it comes to infant mortality. We have a long way to go, being ranked 42nd. But what's interesting is that if you break it out and just segregate the data, it starts to paint a bit of a different story. You see, when we do this, infant mortality by race per 1,000, we see that Black is clearly the highest at 14.4 in comparison to the white peers at 6.4, Hispanics at 9.0, and the overall around 7.5. So not only does Indiana have an infant mortality problem, we have a Black infant mortality problem. And that changes maybe how we approach it with policy and what we start thinking about in terms of prevention and intervention, different things like that. We can't ignore that. And if we also look at the data here for the percentage of babies born preterm or low birth rate, we also see the disparities are very clear. Preterm for Black is 13.4 in comparison to 10% overall. Below birth rate, 12.5% compared to 7.2% of their white peers. It's important for us and absolutely necessary for us to think about when we work together, we must disaggregate our data and think about it in this way. So what are some solutions? There's many things that we can do, but I'm going to draw our attention over here, the organizations and communities. The second check mark. How can we promote cultural competence across the whole health workforce? If we know our children are becoming more diverse, we know that more languages are being introduced. Look, there's 250 plus languages spoken in our K-12 public schools. Unbelievable here in Indiana. And we know that we have disparities that are very clear. How do we ensure that our workforce, health workforce, is prepared for that? When it comes to smoking, we know that we heard the statistic earlier about South Bend and St. Joe County and smoking. 13.5% of expectant Hoosier mothers smoke while pregnant. And if you noticed earlier, I said that these disparities are not only by race, but by place. And so here are the top 10 and the high and the lowest 10 when it comes to smoking while pregnant. And you see that in Grant County, it is 31.4% of mothers. So we can say 13.5 overall. We can say the 10 or 11% that are here in this community, but really Grant, what's happening in Grant, that 31%. And then you see there in orange is 30, Jefferson 30, Crawford 29. Hamilton is the lowest at 2.4. When we just segregate that by race, then we see that overall, that white mothers are more likely in Indiana to smoke during pregnancy than black and Hispanic mothers. But if we break that over age ranges, it starts to paint a different story. As we see here, that is true for under 18. It's true for 18 to 24. It becomes everybody's about the same, around 12% here in the ages 25 to 34, but it changes drastically at 35 plus. So what are we doing with that age group, with those mothers? What are we doing differently? How are we thinking of it? How are we working in convergence? For students and youth, 6 and 10 high school seniors say it's very easy to get cigarettes. Around 37% have tried cigarettes. When we look at tobacco, 14.9% of Indiana high school students have used an electronic vapor product. Now this is down slightly from 18.9%, but it's clearly higher than cigarettes, cigars, smokers, tobacco, and pipe. Why is this significant? Because we know that teens who use e-cigarettes are more likely to take up cigarette smoking. It's a gateway. We look overall by grade level at 9th, 10th, 11th, and 12th grade. Good news is that we have cigarette use is down by a month over the course of the years, but still it's too high. So what can we do? Look at the fourth bullet point. Something that we're hearing a lot of communities think about is how do we deliver culturally appropriate messages that target youth to counter tobacco product advertising? Just to push our thinking a little bit further. Opioids. Opioids now kill more Hoosiers in car crashes and gun homicides combined. Opioid overdose deaths have climbed 126% over the past 5 years. 1 in 10 children live in a household had a problem with drugs or alcohol. And it's across the entire state. It's just not southern Indiana. It's just not rural communities. It truly is. Every county is being impacted by opioids. So what is the impact on children? Prenatal exposure, interference with parent-child relationships, increase of child maltreatment. Remember I talked about the increase the child abuse and neglect hotline. Look at this. The percentage of children removed from home because of parent drug and alcohol abuse for 2016 is over 50%. It's why the kids are being used. There's been an intense increase in students in foster care directly related to this. It's the substance abuse issues. Once again, it impacts the whole family. Heard that. It's the power of one story from our first two stories. So what are some things that we can do? For leaders and policymakers, something that we're advocating for is that as we start to uncover and we start to dive deep into this issue, that the policies that we make have to think about the entire family. It isn't just the one who is abusing the substance. It truly is. How is this impacting the whole family? And what are we doing to ensure supports are in place? The last major issue is obesity. 1 in 3 children ages 10 to 17 are obese. What's very fascinating is that when we asked parents about the health of their child, about 90% say they're healthy. There's a clear disconnect between the perceptions of the parents and the reality of the health of the child. The CDC recommends that children ages 6 to 17 get at least an hour of physical activity each day. So we've broken out what's really happening every day. For ages 12 to 17, only 18.9% are getting that 1 hour. Our kids are sitting still. How do we get them moving? How do we get them out and playing? So we dove a little deeper into some community data. Only 65% of children live in a neighborhood with a park or a playground. Starts to paint a different picture. How are our communities working together to provide opportunities for kids to be active? What are we doing as adults to ensure that they're being active? Absolutely necessary. We take a look at food insecurity. 1 in 5 who's your children are food insecure. 1 in 5 who's your children also live in poverty. And 1 in 7 live in a working poor family. All of these are very much aligned. You see here when it comes to child food insecurity, the lowest is Hamilton County at 12.6. The highest is Fayette County at 23.9. So what is the state of the health for our children? To sum it up, it is these things. Nationally, we excel in few, we lag in most, and most importantly, we need to improve in all. There are clear, disproportionate challenges and barriers that exist. It is vital that we take the statistics and we start to think about the stories and also start to think about how we look at it from race, place, income, age, all of those things. And the 4 issues that we're talking about here today are absolutely impacting children. They impact the whole family. You see, it's in all of our best interests to ensure each and every child is getting the support they need to reach their full potential. So here's my call to action for you. In addition to what we're doing and gathering here for today, I hope that you do at least one of these things. Number 1 is communicate the key data and solutions, either through your Instagram, LinkedIn, all the accounts, or just talking to a friend, a family member. I hope that if you have data and access, promote access to your data. There are so many sources of data that we don't have access to. There's so much new research that is occurring specifically in the opioid space. If we had access to the data, we can start to think differently, potentially, about intervention, policy changes, things like that. How can you create collaborations to work in convergence to make a difference? I hope that you maximize your presence and influence. There's people from CEOs in this room, there's nurses. How can you take your role and have influence? And most importantly, I hope that your learning does not stop today. That as we uncover this, we start thinking about different avenues and different things that we can learn. IYI is a statewide organization. We serve youth workers, and a youth worker is anybody who cares about kids. If you're a parent, or if you coach baseball, or if you work at YMCA, or if you're a doctor, we're here to support you with resources. Contact information is right there. Thank you so much for letting me elevate the state of the child in health today. Thanks, guys.